So I will look at this now. It's okay. Okay. Um, Good evening, good afternoon, good morning, everyone. I know all of you are Nava Ayurveda fans, and I'm very privileged to hold the first panel discussion on diabetes. We have a very impressive panel of experts, and people who have been following the group know we have excellent wisdom. I know across all the geographies, across all disciplines from Ayurveda, nutrition, and I don't know what's the right word, allopathy. That's how we use in India. So very glad, and we chose diabetes as the subject because what I understand, and as you all know, I'm not a medical professional. Very excited that something like this will help the common Indian man. 300 million is the number I heard yesterday, or something more than that. 30% of Indian population is expected to be a diabetic, and a cause of that magnitude. And since we have such a panel of fantastic experts, we thought it's better to understand from a basic. So we don't want to go into the high level ideas on call number one itself. Without taking too much time, I will take the privilege of introducing a fantastic panel. Dr. Bharat Nagendra is all of you know all of them, but just take a minute to explain. Is an Ayurveda practitioner, is a PhD. He teaches in Ayurveda college and very, very passionate about, integrated medicine and helping people. Gayatri is a nutritionist based in Muscat over 25 plus years. Many of us have reached out to her, and her friends have got benefit. Especially, she specializes in diabetic care, and she gets very upset and very emotional. Voice, such a basic thing human beings don't do. So anyone wants to fix diabetes for sure, please go to her. And Dr. Malini is a gynecologist based in Phoenix, Arizona. Very fortunate. I spent 2-3 days in Iowa last week with her, and she has done a master's in Ayurveda from Maharishi University, where Sangeeta is currently teaching. Fortunate to have Sangeeta also on the call. I mean, all of you know she runs the Vaishnavi Trust research program as well. And then she is also a PhD in Panchakarma, currently teaching in Iowa the master students. And I hope I'm not missed anyone. Vanita should be joining anytime. Vanita is a Siddha doctor based in Trinelveli, where it's incidentally the 9th anniversary of Vaishnavi Trust is tomorrow. And that's why you can see I'm brimming with the happiness and confidence, and so happy that we have definitely played a small role in the community, and then it's been a great experience working in Trinelveli specifically. Vanita is a Siddha doctor based in Trinelveli. So Siddha, Ayurveda, allopathy, dietitian, everyone helps in our journey. And last but not the least, Subir, who will anchor the call today, is so qualified. Every day I wake up and thank God for putting such great people in front of me. Subir is an MBBS doctor. He's an ISB graduate, and has specialized in diabetes in Johns Hopkins University. He's working in a pharma company, has interest in AI. And I will just quote only one thing from Sangeeta. Sangeeta said, "I refuse to believe you don't have a formal education in Ayurveda." So that is the level of insight he can get into. Very privileged to have such a fantastic panel. And unfortunately, we could not take questions from the participants. We'll do the moderator panel. And as you all know, it's a very active group and no nonsense group. I'm very proud of that as well. Let us continue to discuss, and probably, I don't know, let's do at least once a month this call. And if it goes well, we will go deeper and deeper into diabetes. Hopefully, we will make a difference in diabetes as well. Thank you all for joining. It's a great pleasure. Over to you, Subir.
Thank you, Mohan, for this introduction. And I myself feel privileged that I am with this august chair of such distinguished personalities who have so deep knowledge about the medical science, and that comes from various perspectives, from modern medicine, from Siddha, from Ayurveda, from nutrition perspective, and this is really, really amazing. So today's discussion, what we are going to have is around a disease which we are all aware of, which we are all afraid of, but unfortunately we know that most of us might have to face it, right? So let's take that disease head on in this discussion today. So we are talking about, of course, diabetes, right? And I'm just quoting from the 2021 publication by Pradeepa Mohan et al. And the WHO report, which says that the number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. And in 2019, diabetes caused an estimated of 2 million deaths globally. Now forget about global. Let's talk about India. The estimates in 2019 showed that 77 million individuals had diabetes in India, which is expected to rise to over 134 million by 2045. Approximately 57% of these individuals today remain undiagnosed. We are talking about almost 10% of our population suffering from this disease, and today we are the largest population in the world. And this is the reason why it's very important for all the medical sciences to come together and see how we can target this particular disease for a better future for both India as well as world, right? So let's begin today's discussion keeping these epidemiological facts in mind by starting the first question. What exactly is diabetes? So I come from a modern science background, and my understanding of diabetes is not as in depth as an Ayurveda expert might have. But we have been taught in our medical school times that, you know, you have got polyphagia, polydipsia, polyuria, which means increased hunger, increased urination, and these are the prodromal symptoms for diabetes. And then you go for blood tests and it will tell that the sugars are very high and HbA1c is very high and all those things. But do we really understand diabetes? Is this the definition of diabetes? That's the first question. So I asked this question to Dr. Bharat to please explain us what diabetes is according to him.
Hari Om, Sri Gurubhyo Namaha, Om Dhanvantare Namaha. I first of all thank this panel, Ayurveda, for giving me this opportunity. So diabetes, like how Dr. Subir said, each person sometimes can have their own perception about this, even though they are trained doctors, Ayurveda doctors, allopathic doctors. So in my understanding, Ayurveda, we're going to talk about how Shastrically Ayurveda is talking about prameham or diabetes. All prameham cases are not diabetes cases. In prameham, there are many other things which have been explained, but one of those is definitely diabetes. So Acharya starts off with saying, when you keep on sitting in one place, you're not active enough, asya sukham. If you keep sleeping more than what is needed, that is swapna sukham. And if you keep eating things which are derivatives of curd, that is dadhini, and then all types of mamsas also, that is gramya, udaka, and anupa mamsas, that is meat. When you have a lot of meat with the fat, then that can also, in the long run, can cause diabetes. And he also talks about payamsi. That is, dadini was a separate set of dairy products which are derived from curds, while payamsi are direct derivatives from the milk. There are people who use butter from milk, ghee from milk, and some people use the malai. We have these malai rotis and all that. So these are also contraindicated if you are a diabetic person. And if you want to avoid becoming a diabetic person, if you have a genetic vulnerability, and if you have some predisposing factors, then it is better to avoid these things. He also talks about not taking much of sweet items, Guda Vaikritam, he says any type of jaggery or jaggery related products needs to be avoided. These are all increasing the kapha in the body. This is what Acharya is talking about. This increases the kapha in the body. And when this kapha is increased in the body, slowly, when I say kapha, I think we'll have to have a separate session to understand what is kapha. You can understand that it is one of a group of attributes or gunas in the body, like vata, pitta, and kapha. This holds good for all the three. A group of attributes in the body will either increase or will decrease when a given set of causative factors the patient is exposed to the causative factors. So for this set of causative factors, which will increase the kapha, those are the ones which have been told by Acharya in this one. And he also very specifically talks about some tissues in the body which are affected by prameham or diabetes. He talks about medascha, mamsamcha, sharirajamcha, kledam. That is, medas is the adipose tissue or fat. Mamsam is the muscle tissue that we have, and the sharirajamcha kledam. The kledam is the liquid part of the body which helps in transferring materials from one place to another. We can relate it to the ambu karma that Acharya talks about, the osmotic action where the sugar is being, the glucose is being transferred from one tissue to another, from blood to muscle and such things. And I'm very sure the modern allopathic doctors will also be in concurrence that both the fat and the muscle tissues are also holding sugar in them other than the blood. So these are all things which were actually researched and they were documented in Ayurvedic treatises. This is what we are trying to explain now. And these doshas get affected, both all the three, kapha, pitta and vata, and they affect these specific tissues and then create prameha. So prameha is not one dosha disease. It starts off as a kapha, but then ends up something else. So this is the basic introduction about prameha in Ayurveda.
Oops, I was on mute. All right, perfect. Thanks. This was a great introduction, at least for somebody as naive as I am in terms of Ayurveda. This is a good explanation of what really causes or what is diabetes as per Ayurveda. But let's now take a step further and try to understand how modern medicine sees the same disease from its perspective. Dr. Malini, can I ask you to unmute and explain that perspective?
Sure, Dr. Subir. So it is, as we told, like, even though we understand that there's two different specialties, but you can see that on the practical level, they both are talking about the same thing. So whatever Acharya told as a cause, if you convert it into a modern science, what we do right now is like basically a combination of what we eat and what are we doing. I think that's those imbalance in those two is a basic problem. And so as Ayurveda always focuses, even on a practical thing, you see that the digestion is the key factor where it all starts. We are eating what we are not supposed to, and we are not spending what we ate. That imbalance, I think, is the very, very, very initial cause, which again matches with what we understand. So when the excess sugar is, from the abnormal consumption, when the excess sugar is getting into your body, that's your basic pathology first. And then I think there is definitely sugar is one molecule that every tissue in our body utilizes. And even there is a vasculature when there's basically a tube carrying in normal water and then sugar mixed water causes a lot of baseline inflammation in our body. So I think there is an excess sugar is the initial problem, and then from a damage, multiple organ damage, that is actually basic pathology. I think if we keep this in mind, that is diet, what exactly Acharya has told, that is an imbalance with what activity we do, heavy consumption of heavy fat food, heavy to digest food, which exactly Dr. Bharat said. So I think it's a mild chronic inflammation and the baseline, it is a cause, and which makes your sugar level much worse and worse and worse. I think it's like a vicious cycle. Increased sugar, increased inflammation, increased tissue damage, and then your insulin is becoming more resistant. I think it's just a vicious cycle that's going around. So.
Got it. Yeah, I agree with you. Being from similar background, I think this is what we also understand in terms of what diabetes is. But then the question comes in my mind is that if this is true, and I know it's true, the question is, we have got a huge population, and of which around 7 to 8% right now have got diagnosed diabetes mellitus. But the disconnect between diet and what is needed, what we need to eat and what we eat, there is a disconnect in that, which what you're saying is causing this epidemic of diabetes. But this is true for majority of the population. It's not only for only 10% of population. So why is it that a small subset, it's not a small subset though, it's a huge subset, but there is a huge subset of another subset of our population who have this dietary imbalances, but they do not have diabetes mellitus. So I want to quickly take this question to Gayatri to get her perspective on the question which I've raised. You're on mute, Gayatri. Yeah, now it's okay.
Good evening, and thank you for giving me this opportunity. So yes, not everyone who has this imbalance in their diet lands up with diabetes, and that is where probably the activity levels, number one, come into play. Genetics would be the most important. If you're predisposed to diabetes, for example, I always say we all land up here like loaded guns, right? And the environment is the trigger. So in case we are able to keep the environment clean and clear, and we are able to have the right amounts of food diet in terms of diet, then we are safe. So there are some people who do the entire lifestyle wrong. They're not eating correctly, they're not exercising, managing of stress is bad, sleeping habits, sleep hygiene is poor. Then you see that if they have a genetic predisposition to diabetes, that's where environment becomes a trigger. Whereas some people may be doing just the diet part wrong, and they may be getting the other pillars of health right. So I still think it's only time which they're just pushing it away a little. It is going to come if the imbalance of calories is there. So lifestyle plays a very, very big role in determining whether you're going. It's calorie in versus calorie out, basically. So diabetes is a disease or disorder where you're not balancing your calories well. So carbohydrates play a major role, and like Dr. Bharat and Dr. Malini suggested, it's also the fats that play a role when it comes to diabetes. So being very careful with the diet and exercising well, activity plays a very, very big role in diabetes again. So I hope I answered your question.
Yes, you did. No, Gayatri, thanks. This is quite relevant in terms of the question what I asked, and you actually bring up a very important term, carbohydrates, when you are talking about diabetes, and it's quite interesting to talk anecdotally. I'll give you an example what I mean. If you look into South India, and I'm talking about, let's say, 50 years from before now, not today, okay, 50 years before that. I don't think diabetes was such a big problem over there. Everybody was having dosa, everybody was having idli, rice is a staple food, everybody's having that, right? And suddenly, in past 50 years, there is an explosion of diabetes. Nearly everyone is diabetic over there. In fact, there are lots of papers which shows that South India represents a population which has got one of the highest prevalence of diabetes mellitus. And it shocks me because I come from east part of India. For me also, my staple food is rice. And my wife's grandma, she was a very lazy person. I don't want to speak ill about her, but it's a fact. She was a very lazy person. And she would eat sweet every morning. It's part of our DNA. We would wake up in the morning, we'll start with the jalebi, okay? And we would have luchi torkari, which is nothing but puri and aloo ki sabji, all right? that would be our staple morning breakfast. In lunch, we would have heavy amounts of rice with lots of fish and everything. All right. And she survived for almost 97 years without any diabetes. I know it is anecdotal. I know it's not statistics. All right. But I have a lot of such examples. When I look at I talked about the South India, right? The South Indian story. Everybody eats dosa, rice, idli, and suddenly last 50 years, everybody has got diabetes. So what's this 50 years thing? What has happened in this 50 years? Is that we overdiagnosed, or we came up with a definition that this is diabetes and let's diagnose everyone diabetes? Is it that people were earlier also dying and we are now recognizing that they died because of diabetes? Because my wife's grandma didn't die. She lived a pretty normal life for 97 years with all that bad diet. We might, we might judge that as bad, high carb diet. So let me take that perspective from Dr. Bharat, if it's okay.
Yeah. So, like how Gayatri ji pointed out, it is not only the diet, it is also the other pillars. We started off with causative factors. We were talking about Asya Sukham, being lazy, Swapna Sukham, sleeping more and all that. But other than this, there were some other things that Indians were doing right. That is the cleansing processes, they were doing it right. We have forgotten those processes. We have these three Vamana, Virechana and Vasti processes, which each person was undergoing on a every year, yearly once. Everybody used to take these cleansing procedures. We have forgotten this. Vamana is induced emesis. You take some medicine and you start getting vomiting this thing, and you throw up whatever is there inside. And this was considered as it cleanses the kapha from the body. So it is very important in diabetes. We even today in treatment, we use this, especially for prevention. And then second one is Virechana, which was practiced even till about 15-20 years back, where purging the gut was a traditional thing to do. Even in Siddha, I'm very sure they used to say Naal Irandu, Varam Irandu, Madam Irandu, and Varudam Irandu. This Varudam Irandu is twice in a year you can take this purgation, you can cleanse your gut. People have literally, forgotten about this. You can cleanse your gut, and then the whole gut flora can be regrown within some days, and it keeps you very healthy. There is always some amount of leftovers, even when you have your very good bowel movements on a daily basis and all that. Even when your this thing is health is very good, still Ayurveda helps you to have a swastha rakshanam is the motto of Ayurveda. That is keeping a healthy man healthy. I think this is second thing we have forgotten. And the third thing is Vasti. That is just before the rainy season, they used to take 8 days course of Vasti. This was, mind you, this was done to healthy people and to make them stay healthy. This is one of the very important reasons why we have started. I think the number of cases in diabetes has started to increase in the last 50-60 years. The second reason I believe is we have lost that capacity to work. We do not do our day-to-day chores with our own hands anymore. This is like we used to pound the rice before we used to have it, and food was also healthy, and at the same time there was also a lot of exercise involved. There was a lot of walking involved. I know that my own father used to walk about 15 kilometers per day just to go to school. I'm not saying that you should choose a school very far away, but what I was trying to say is they did not hesitate to take that long walk on a daily basis, and this exercising was a part of their day-to-day life. And we also had regular rituals which was very different from each person to person, from their based on their backgrounds. There were some religious rituals that we used to follow, where, for example, we do Sandhya Mandaram on a daily basis. We have to sit in one specific asana, like how we are using the Indian toilet, and you have to sit in that position for 15-20 minutes. It stretches your whole spine very well. I don't see even 5% of people doing Sandhya Vandanam nowadays. So stretching out and these things were a part of your own ritual on a day-to-day basis. I think these are small causes, but definitely they have hurt us because we have not been practicing our very traditional things that we should have been continuing to do. Any
Thank you,
other
Dr.
points?
No, I think I completely agree with you. I raised that question of 50 years back, what used to happen and what has changed. I can just correlate what happened within my family. At least one generation back, we used to wake up very early in the morning, especially during the Brahma Muhurta, and then we would all pray to God. We would be facing north or northeast position, and we would pray to God. We would hum the Om sound, and we would then smell something fragrant, and then we would touch something sweet on our tongue. And it was always, we would start the day with that, and then we would have the morning ablutions, and we would keep everything clean. And then there would be at least half an hour. We would just go for a walk, and it was every day. My father used to do this as a part of a discipline. It was not that he understood the science, but it was being carried on from generations, from his parents to him and then to us. And then somehow we got into the modern lifestyle, late night parties and late night movies, and then not waking up early in the morning, no routine, do what you want as you feel. Maybe that has changed. I think that might be a major reason what might be contributing to today's epidemic of diabetes. I'm not sure, but let me ask Dr. Sangeeta over here. Let's say, whatever has happened, and now we have diabetes, right? How do you treat it? What do you do about it?
Hari Om Jai Gurudev. Thank you, Mohan sir, for giving this opportunity. And I think right question. I'll just give a reference. The place where I'm working at present, Maharshi International University, it's like a small ancient India. And I can see people, 90% of them are above 75. Not even a single case or client of diabetes in the whole community.
Wow.
Because they all follow the daily regimen, the seasonal regimen, the food, the diet, the lifestyle, and understanding the self. Sometimes, like we are all discussing more over on the diet. Diet is just only one part of it. Beyond diet, there is also the way of lifestyle we are living. There is also the mindset of us, how we are leading our life at present. 3 decades, I'm sorry, I'm on the airport, so many announcements going on at the back. The way we are living and the way we are thinking. Just the globalization has hit us in a very different way. As you said that South Indians used to eat rice, North Indians used to eat roti. The place they stay, the locals, what they eat, used to make a difference. But now in Chennai also, you'll get everything what is made in North India, and in Kolkata also, you'll get everything what is made in South India. Due to that globalization, the food has completely changed our body, our structure, because we genetically we are not made for that. Right? And that had make a big difference. The place where I stay in, I'm emphasizing the point of understanding the self, that sometimes it's not just food, it's not just the lifestyle we are living, it's also the thought process we are going through. In last 2-3 decades, India has, of course, tremendously increased in developed in every aspect, but the youth is really going through the high level of stress of competition, stress of, we are running. We're just running. And that running is also making a big difference. It's not just the food, but also major factor is what I feel is, of course, Sharirika, Manasika, and every other aspect of our life. As you said that we used to have a very good routine. We used to get up in the morning, do the puja, every other ritual. These are all fading because we are all masked up by the goggles of West. So that is also making a big impact.
Sure. No, actually, what you raise is a topic very close to my heart. The place you talked about, wherever we are today because of globalization, it really doesn't matter. We have got access to everything, right? I can just sit over here and have Peruvian food, which is and enjoy that and say that, wow, that's a great food. But there is a huge amount of research which points towards the fact that imagine our body to be like a sugarcane machine, from which the sugarcane juice comes out, right? And if I put stones into that, that machine will crush the stones for some time, but will get eroded over a period of time. So similarly, if I'm from East India and my ancestors, they kind of grew in that particular land, it means that my genetics is devoted. I won't say devoted, it's like it's customized to digest the food which grows in that particular land and to accept the environment which is there. And this is not just a theory. There are a lot of research now. So for example, if you're in Japan and you migrate to US, immediately you start getting all the chronic diseases over a period of time, irrespective of what food you are having or what lifestyle you are facing. But it's a topic of high importance because maybe globalization might be driving these entire chronic inflammatory diseases, including diabetes. But I started with an original question that, all right, right now, we cannot do anything what has happened or what is happening. Say I've got diabetes, what to do? So you have a patient who comes to you and asks, I have diabetes. How will you treat that particular patient? What will you advise that particular patient? Sangeeta, I will start with actually you on that.
Yeah, sure. So in Ayurveda, when we study about the Chikitsa Sutra or the treatment principle, management principle of Prameha, or any other Ayurveda disease, Acharya always starts with Nidana Parivarjanam Eva Chikitsa. He says that
sorry,
removal.
Sangeeta.
Yes,
Sangeeta, I know I'm intervening, but this is going to hopefully to global audience. All of us have to learn to speak slowly, right? I know. That we are not faster. Slow.
In fact, I am also guilty. I speak really fast. I'm sorry if I did that.
Oh,
okay.
I should slow down the pace, sir. I'll surely do that. So Acharya says that removal of causative factor is the first line of management. So when a client comes to us, for example, any client of any middle age or higher age, you just have to take the detailed history of the client, understanding the lifestyle of the client, the food habits of the client, the way the client thinks, what is the work, what is the occupation of the client, and what all is going on in his or her life. Understanding those causative factors and slowly making them understand that what are the checkpoints you have to take care of. Okay, the food. Now you have included, as you said, that rice. In good olden days, maybe like 3 decades ago, South India was also eating lots of millets. It's not just rice, and the rice variety what they used to eat was not this polished hand or the rice. The rice was it was like red rice or different qualities or varieties of rice was being eaten, and different kinds of millets were eaten. So we have to just start modifying their lifestyle step by step, not overwhelming them, not just, it cannot happen in a day, of course, because the disease took a toll in a decade. It just appeared today, but maybe the thing was happening 2 years ago, 5 years ago, 6 years ago. Could be a triggering factor just made it represented to us today. So first, the changes in the diet, then the lifestyle, and also as I again said, understanding the self. You have to go through yogasanas, pranayama, meditation, everything. And that is the beauty of an Ayurveda practitioner, where they are both physicians, they are both psychiatrists, they are both counselors, they're everything. Because when the client comes to them, they take it in a detailed way, understand them, they give them time, make them understand the problem of the disease and other things, and then give the management stepwise. So that makes a huge difference. I'll just give an example. Of course, now Modi ji this year, millets is a big name throughout the country. We are promoting millets. So in Prameha Chikitsa, in the treatment of Prameha, Acharya Charaka mentions about 6 types of millets. He says kudo millet, pearl millet, little millet, ragi millet, all the millets are mentioned. And over of the top, barley is the first and the foremost grain. Acharya Charaka mentions that barley is the first management or the first thing which you should give to the client in different forms, in concoctions, in decoctions, in liquid form, in food part, in any way, Barley has to be consumed in different ways. And again, I'll come back to the same point. We are modernizing the things. Yesterday, I visited a family friend and she said that I have brought so many cookies from India made up of millets. I'm sorry, cookies are not the option for, for eating the millets. So it's not just the grain what you are eating, the form in which you are eating makes a big difference. In the same way, different kinds of pulses, like red gram is to be preferred, moong dal has to be preferred, chana has to be preferred. And again, list of vegetables is mentioned, which vegetables has to be preferred, fruits have to be preferred. And that makes a huge difference. Gayatri will accept that point, that diet itself can make a big difference in the life of the clients. And I'm lucky enough to say that I have reversed the diabetes of my husband. He got that due to COVID. After COVID, he got it, and he's touchwood not taking any allopathy medication. His HbA1c was 9. And only the difference which made was the diet. Of course, so many Ayurveda formulations, which by God's grace, my teachers helped me up to, design the protocol for him. But diet does really, and he's like completely kapha prakriti person, huge personality, overweight, obese, everything. But diet really made a big difference in his life. And it can make difference in any one of his life, including exercise, vigorous exercise. Acharya Charaka say one has to walk shata yojana, one has to dig the wells, one has to do vigorous exercise. So of course we cannot dig wells at this point of time, but we have to do exercises which are muscle strengthening exercises, which burns that glucose at some level, and that helps. Set of yogasanas have mentioned, and they bring a big difference in the metabolism of the person, along with breathing exercises, pranayama, kapalbhati, different kinds of pranayamas. And last but not the least, very important, meditation. These all things as a combo with 25% of herbal medication or any kind of herbal mineral compounds can bring a big difference in client's life. This is what I'm practicing here on the core level, and I can tell it with confidence.
Perfect. No, this was great explanation of how you treat a patient with diabetes. Thank you, Dr. Sangeeta. I'll come back to you on the vigorous exercise part a bit. I have a question on that, but before I do that, I saw Dr. Bharat was raising the hand while the conversation was going on. So let me get back to him quickly. Dr. Bharat, I think you had a point that you wanted to make here.
Yeah. Not about the treatment as of now, but like how Subir ji or Sangeeta ma'am said, when we were talking about the causative factors, why this comes, I missed out on talking about the routine. In fact, Subir ji very exactly pointed out that there is no routine nowadays. We don't follow a routine. We do whatever we want. We eat whatever we want. Sleep at any time we want. Most of the people whom we see with diabetes have a long chronic history of not having a very good routine. Most of them, they have this very bad routine. They don't wake up early in the morning, and we have something called as dinacharya in Ayurveda, where Acharya starts with Brahme Muhurte Uttishtet. Exactly, the Brahma Muhurta, just about 48 minutes, 50 minutes before the sunrise, you are supposed to wake up. Most of us don't do that. That is the first pillar of being healthy. And the second thing is Jirna Jirnam Nirupayan. After knowing that you have digested yesterday's food well, only then you're supposed to get up. Or else take some medicine, make sure that your Jirna has been done well, only then you wake up. You give your body some more time. Okay, and then the second thing that you do after you wake up is, that is, waking up is the first thing. Immediately after you wake up, you have to go for malotsarga. You have to go for having your bowel movements for the nature's call. This is missing in most of us, like how a good clean city or a good clean house or a flat gated community must have a good drainage system for you to keep every other place clean. Your drainage system is your malotsarga. You wake up in the morning, attend to your nature's call as the first thing, and most of the people do not understand what is constipation. Usually, unconstipated bowel is something that when the person passes motion where it takes lesser time for him or her than urinating. Because urine comes out with a balloon effect from the urinary bladder, while motion, it just drops down because of the gravity. These things can be gross when you hear about it, but this is the fact, this is the truth. And once the person has passed motion in this way, the second time he or she must not pass on the same day. So this is the first thing that you're supposed to do. And then there are a set of things that you can do regularly, like how Sangeeta ji very vividly explained about vigorous exercise, that is vyayama. There are specific times given for specific things to be done. If they follow this ritucharya properly, if they have this routine nailed, spot on, then I think their genetic predisposition will also be negated to a certain extent. This I wanted to talk about. And one more thing is the ritucharya, which we already talked, that is the 3 cleansing procedures. And then the migration that Subirji very vividly he pointed out. We see a lot of people also getting allergies, skin allergies, and many other diseases immediately as they migrate, especially young children whose immunity has not developed well. In their very early ages, by when they are 2-3 months old, they travel back to the US because the child is impregnated in the US. The father, mother, the pregnancy happens over in the US. They come back to India for getting the delivery done, and then when the child is about 2-3 months old, they then go back. This kind of rapid change in climatic conditions and environment immediately has a big toll on the immunity system of the child. These cases also we see a lot, and in these immunocompromised children, when you follow them closely for some years, you understand that very soon they become diabetes patients. But the sample size that I have might be only about 10 or 12, but this is very, very important to look into this. Thank you.
Perfect. Thank you, Dr. Bharat. Let me now pull back Dr. Sangeeta, because there was this question which was raised by the one of the audience and YouTube. Have you witnessed a patient getting, so you have witnessed a patient getting cured of diabetes? If you have such kind of experience, please explain.
I won't say cured. This word is exaggeration. Because as Acharya Charaka also in Ayurveda mentions, Madhumeha is Yapya Vyadhi. Yapya means it has to be maintained, it has to be managed. Provided if really the client is so dedicated and devoted, you can surely bring him back to the normalcy. We can manage the condition very well without going into the complications. What we know is, yesterday I was reading a statement that diabetic management is like treating the failures. Stepwise, the dose increases in conventional medicine. Stepwise, the disastration of the organ systems happen. But when it happens in Ayurveda, we can surely manage this situation to a greater extent so that they don't go into the organ damage. They don't enter into those complications which can lead to disastrous conditions. So that can really be helped.
Perfect. Thank you. I actually want to go to, yeah, what? Who's this? Yeah, sorry.
Can I just compliment what you said?
Yes, sir. Yes, sir, please.
See, with Ayurveda, we have seen a lot of patients reversing diabetes, coming back to their euglycemic levels, definitely euglycemic levels. And we have seen many people who have stopped medicines and they are without any symptoms. But then, yes, they have to follow the exercising routine and their diet. This is my experience.
Perfect. I want to move to Dr. Malini for another question, but before that, I have this burning question going on in my mind to Dr. Sangeeta, and that was regarding the exercise, what you're talking about, the vigorous exercise. And I'm as I said, I am completely naive when it comes to Ayurveda. I'm still at a very early stage of learning Ayurveda, but I was reading through Dinacharya, which is chapter 3 of Ashtanga Hridayam, and in that Acharya says that in case of morning exercises, when you're exercising, you should be using half of your strength when you're exercising. This is how I read the translation. My understanding of Sanskrit is absolutely nonsense. I don't really understand, but that's the translation I read. And based on my understanding of how the exercise physiology works, it made sense to me. But I want to now ask you, you said that it has to be rigorous. What do you mean by rigorous?
Yes, you have rightly understood that it is Ardha Shakti Nishavidya, means the exercise should be half of your capacity. Means you should not get overexerted. But when it comes to Madhumeha patient or which Kapha and Meda is highly increased in that point, their Acharya says that he or she needs a little bit more, maybe a little
Got it.
bit more to burn out that accumulated Kapha and Meda, and that excess kleda in the body has to be drained out or taken it off. But here doesn't mean the vigorous exercise doesn't mean taking high protein shakes and going to the gym with complete belly full. No, this we are seeing during this phase of last 1 or 2 years. We have lost so many, big personalities, big people, and some their studies are showing that okay, that could be the reason that they are doing more than their body is needed, or they are not doing it in the proper way, or whatever could be the reasons, and that stands right. When we say exercise, when we say yogasanas, moderation is important, and of course timing is important. The way it has to be done is to be important. So these factors has to be taken care and careful.
Perfect. No, thank you. It's a old adage in every culture, I guess. Half knowledge is super dangerous. I'm right now at half knowledge. So thank you for letting me know what happens in diabetes. And it's an exception where you need to be more rigorous with regards to your exercise. Thank you. Now let me quickly go to Dr. Malini. And the reason why I wanted your comment was that we are talking about why diabetes happens. We are talking about what diabetes is. We are talking about management of diabetes. But for a common man, when should he go to a doctor with the suspicion of diabetes? When exactly he should start approaching a doctor?
Dr. Shobhit, can I also answer for the question that is the off exercise capacity? Remember, the capacity changes for the same person based upon how well you exercised. So that is when it's off capacity is like when you're starting. So you will notice that every 4 to 6 weeks there is an adaptation in your body. So your capacity increases. So that is what the capacity really guides you. So, and also Ayurveda beautifully says who's supposed to be more exercise person. Like if it's a Kapha person, you need to be more of an exercise longer, and then Pitta can be a moderate, and then Vata person has to do a gentle exercise, and then the capacity will change too. So I think being persistent on exercise, you will notice that the capacity will increase. So. Yeah. And then moving on to the diagnosis, I think also thanks for all our Ayurvedic doctors telling us opinion. I think that's the biggest thing that our modern thing has to learn from them. It's like, just diagnosing and treatment is only a small portion of the treatment. Just looking into what is the causative factor for this particular person might be a stress or might be irregular routine. Or I think that is a key thing that we have to learn from them. And then all that Ayurveda, Dinacharya, and the seasonal changes, routine, what they're recommending, I think all of us need to adapt, no matter what, they're diabetic or non-diabetic, so that we prevent, because same risk factors lead to other stuff. So, and then how do we diagnose? My suggestion is always a low threshold for suspicion. So anyone with a risk factor are given obese and low activity, any risk factor you have, I think there should be a regular screening going on. So, and then I think waiting for, as we discussed, we wait for the symptoms to come, like increased hunger, increased thirst, burning sensation in your palms. They're a little late, but those symptoms do help some patients. If you're having this kind of symptoms, please get checked for diabetic. But otherwise, at the age of 30, I think most of us agree, some 25 to 30, based upon the risk factors. Just a regular screening, talking to your doctors about your symptoms, and then just a simple blood test alone, like a fasting sugar, can itself at least give an idea where we stand and do we need to go to the next step for the treatment.
Perfect. So what you're saying is, if I'm trying to summarize well, is that we should be vigilant, that there is a chance that there is a risk of diabetes after the age of 30, and with more risk factors like obesity and the lack of discipline what we have in our life, our chances of diabetes is higher. So we should keep on screening ourselves regularly, checking the blood sugar, and make sure that it's diagnosed at a very early stage. Okay, perfect. Now, we are in a modern world now and we have to accept it, right? We have all processed food. I myself am guilty of it. I am super lazy person. I have a very hectic schedule of work. So I lean on to the processed food all the time, the packaged food all the time, because in the morning my kid has to go to his school. I wake up in the morning, I've got my conference calls going on. I don't have time. My wife doesn't have time because she also goes to work. So we get this package food, just heat it up, give to the kid, and then move to the daily routine. We also have similar kind of food. So I want to take this to Gayatri and ask that, given the situation that we are facing now, that our supermarkets are loaded with processed food. Everything is pre-packaged, everything is pre-cooked. It's easy for most of the people. You cannot change the population behavior by saying that, no, this is all nonsense, you cannot do it, you will fall ill, right? Is there a middle path that you suggest to naive people like us who do understand the science, but still they would lean on to the comfort and go on with the unhealthy lifestyles?
Yeah, this is a fantastic question. And I am sorry, I will not be able to speak the Ayurveda language. I am a little lost here when it comes to, I am going to learn more about this. But first of all, I think the very notion that all processed food is bad needs to go. Because that's one thing that we should learn to do, is to read nutrition labels. So there are processed foods that are okay to be taken. And there is this vilification of frozen foods. There is this vilification, like I think Ayurveda insists on local, be local, buy local, seasonal. I live in Oman. There's nothing local in this place. Okay, it's a desert. So we don't grow anything much. Everything is imported. Fruits are imported. Vegetables are imported. Everything that we eat comes from outside. So that doesn't work for us. Then what do we do? So that's when you do think of frozen foods. So what are frozen foods? Why is it not bad? So frozen food is something you pluck in a farm, and within a few hours, you're freezing it. It's as good as fresh. So the main difference between a frozen food and what you directly pluck from the plant is the amount of fiber. Okay, they do have to pull out a little fiber from that in order to freeze it. But otherwise, it is nutrient dense. You do have the nutrients in it. So in places like Oman, where you don't get stuff, or for example, my daughter, she's 22 years old. She's such a hectic life doing her PhD, right? So I can't expect her to be cutting vegetables every day and making meals every day. So that's when I encourage her to read nutrition labels, to look at frozen foods, sometimes at least. It cannot be a part of your daily meal, which is for sure. You have to have a balance, a moderation between what probably have something like that for lunch, and then for dinner, pick up a packaged meal. But nutrition labels and reading and understanding the nutrition labels, I think that's a class in itself, because it says, serving size, and you really have to be extremely careful with nutrition labels. You can land up overeating a meal simply because you don't know how to read the nutrition labels. So one thing is, there's no harm in using processed foods, provided don't go for the ultra processed foods, is what I would say. So there is a clear distinction between the two, and moderation of this. So balance your meals. The days that you're extremely busy, go for these foods. The days that you're not busy, invest time, meal prep. So generally we know that the week is going to be hectic for us. So then you meal prep, half cook your foods, freeze it, learn how to freeze your foods. These things, I mean, may not go in the Ayurveda world because I know it causes issues. But in the current world, in our current generation, we have to agree, and I do agree. I mean, my clients, I give them the easy way out of this.
No, thanks, Gayatri. I think, see, as I told you, my situation, and irrespective of what I learned from the experts of Ayurveda over here or elsewhere, and I completely agree with them that this is troublesome, that we are eating something which is not local, we are eating something which is not fresh, we are eating something which is not seasonal, and we are eating something which is not regional, in the sense it's not from us. and it's going to create inflammation, it's going to create problem. Unfortunately, my life is such, and I'm sure there are millions like me whose lives are such that there is just no choice in spite of all the knowledge, whatever we might gather. I heard somewhere, and I read somewhere rather, that even the freezing process, when you freeze something, you are freezing the moisture inside it. It changes the nature of water, and it seems, as per Ayurvedic theories, water has memory. The moment you change the temperature, its nature changes, and everything associated with it changes the properties. It may be subtle, but the changes are there, which is inflammatory for the body. Unfortunately for me, I have to accept that inflammation and move on with life, right? So that's why I asked the question to you, but thanks. I think you are right. We need to
I'm very
be
glad I
smart.
started off by saying I didn't know much of
Even I don't
Ayurveda.
understand. No. That's why we have experts over here to tell us where I am erring and where we can, do better in terms of the choices what we have. Dr. Malini's hand is up. I need to ask her to join in here.
So I can speak for both. That's why I kind of want to chip in and tell. So a lot of times we assume that, a lot of Ayurveda knowledge is actually golden knowledge. That a lot of times by accepting it, then you start looking for the answer actually. So that's why I don't want to give them a lot of alternative option. Again, a freezing process, I do agree with Gayatri that we freeze ovum and sperm and make them pregnant later, right? That's it. So they do live alive. They live alive. But the thing is, it's an energy consumption process again, right? So, yeah, guys, you're saving. You imagine the package and freezing, transporting. You're adding energy every single point. So I do agree, Dr. Subir. It is very tough, but exposing your being open to what Ayurveda is telling us. When I started back this journey 4 years ago without any Ayurveda stuff, when I got exposed, I'm like, how am I supposed to live with this, right? Because there's so much information. I'm like, again, I'm just like you guys, super busy. But once it's there, it shows you the way. One by one, okay, I can do this better. Okay, and also seasonal was basically recommended based upon where you live, and also it's a season, right? So even though I get the same vegetable all year, given living in the US, but I do know that what vegetables I can eat in Vata season. I pick what, even though it's not, I don't know what the season right now, but I can pick out of this thing, okay, this is summer, I'm going to avoid this particular things, right? Like highly inflammatory food, like large tomatoes, lot of green peppers. So those things I limit, even though I get this all year. And coming to Vata, so I think what they said in seasonal was what they grew, but you can same sense we can use when it's all available. You pick and choose what you want based upon the season and based upon who you are. Like if I'm a Vata Prakriti, right? And then I'm doing, so that's what I'm telling you. Just don't look for an alternative right from the go. Let's learn what is right. And then it gives you, okay. And then, I do agree with the Gayatri Ji that, where they live, again, from there, I'm sure that environment provides you something much better, because there you're with the being dry and climate, you're probably more tolerable to frozen stuff because your kapha is low naturally. But same person cannot follow the idea living in a deep winter because that kapha is going to add up more to your system. That's why having the Ayurveda knowledge, even though everything is available around you, which is a plus, let's take it as a plus, but you pick and choose. Choice is always a blessing. Let's not take it as a curse, right? But just don't pick a wrong thing. But it is adaptable, totally adaptable, and slowly can ease into our life. And also the busy lifestyle, also I think it's a time that we need to balance. We cannot give our health for a busy life, because that does not work. Today or tomorrow it's going to cost us. So we just need to prioritize, and then by just prioritizing what we need, automatically you find the way, and simple meals that you can still live in an Ayurvedic lifestyle recommended,
Yeah. No, yeah, I think you exactly echo what I feel, Dr. Malini. And most of the times, I feel that at least from health perspective for me and my family, I think I would have had more choices if I would have been in India. Here we have everything available in front of us, but in US, but we have to be conscious all the time in terms of the choices what we make. In India, my vigilance would be much more lesser because I know that, all right, things are available seasonal, local. I can just be, I can relax in terms of the cognizance I might use for choosing the food. But thanks for the perspective, Dr. Malini. Thank you.
Thank you.
All right, so I think we have covered quite a lot of questions. Now let me look into something which is coming from YouTube. The question is, how important is Nadi Pariksha? Does it help understand the level of impairment caused by high sugar levels, despite what you hear from patient about his condition? So let me take this question to Dr. Bharat.
Yeah. Nadi Pariksha basically has a lot of importance when it comes to Ayurveda. Nadi Pariksha is something that for people who do not know, I'm very sure this panel knows about it, but people who are watching, Nadi Pariksha is something we have a small, we take the pulse from your hand and we'll be able to understand what Vata Pitta Kapha is deranged in your body. It is a way that has been explained by one of our acharyas in a very vivid manner. And in my practice, I don't only use what Ayurveda says about Nadi Pariksha. I also use a little bit of Nadi that my father taught me from Chinese medicine, from acupuncture and acupressure. I use both because nowadays having a good Nadi Pariksha Vaidya teaching you is becoming rarer and rarer. So I use both of this in my practice, which gives me a lot of insight into what the patient is going through. And sometimes, as we have discussed till now, the patient does not understand what is happening in his body. That is, they are not vigilant enough to understand what is happening in the body because of the fast routine that they have, because of the very fast life they have. And actually Acharya also talks about very specific tissues which are being affected by this high sugar levels, or what we call as prameham. He says medascha asra shukra ambu vasa and lasika, that is the fat tissue, the blood, the sperm, the semen, and then any other watery tissues in the body, and then the majja. Majja is the bone marrow, and lastly the muscles also, pishitam. All these are directly affected by high levels of sugar. Like how Dr. Malini said, almost every cell in the body uses the sugar, but there are some specific tissues which are affected more. When I'm seeing this Nadi that I told you, I have this way of diagnosing with Nadi where I use both Ayurvedic way and the TCM way, the traditional Chinese medicine way. We'll be able to have a small insight about each and every major organ in the body. That is sometimes the liver, the spleen, the heart, and then there are also other organs which are involved, which we call as koshtangas. Koshtangas are specific organs which are involved in all the three, that is a digestion, absorption, and assimilation in the body. Diabetes is also a disease where after digestion, either the absorption does not take place properly or the assimilation does not take place properly. That is because of the insulin resistance, the patient is not able to convert this sugar into energy or into other tissue forms. So this is also taken as assimilation, or we call it Dhatva Agni. So basically having a small insight about each of these Koshtangas definitely happens because of Nadi Pariksha. This scientifically validation of this, scientifically means Ayurveda has it is its own science. When in modern terms you want to explain this, it is like trying to translate from one Indian language to another completely alien language. Sometimes people don't understand what this is. If you are trained in an Ayurvedic way, if you are trained in a Nadi Pariksha way, and if you have been practicing it regularly, like one of our panelists, I think Dr. Malini said this, when you believe in this and then you start searching for answers, yes, it happens a lot. In my practice, I have seen many people after seeing their Nadi, I'll be able to tell them which organs, especially the liver, spleen, and these organs, like how I told you, the koshtangas, we'll be able to have a good insight about that. We may not be able to tell what exact pathology is happening, but we'll be able to definitely tell with what less knowledge that we have. We'll be definitely able to tell that there is some problem with this organ, and searching for reasons, searching for causative reasons where these organs will be affected is a very good way of doing it. So yes, Nadi Pariksha helps a lot for both the doctor and the patient who's getting it done.
Perfect. Thank you.
Please.
Great. So let me now move on to the last question for today. Okay. And when I say last question, it doesn't mean that we need to stop today's discussion. We can always keep questioning and we can always come back answering those questions. But the last question, what I had in my agenda to be that I wanted to ask this panel was actually to Dr. Malini. We have heard all the aspects of diabetes from both modern medicine perspective as well as from nutrition perspective or from Ayurveda perspective. I want to understand, in today's world, modern medicine is a fact that is being used by majority of the patients. Okay. Now, if we want to integrate both the sciences, we know that there is value in both the sciences. If we want to integrate both the sciences and make sure that we get the best out of both for all the patients, what would be your recommendation?
So it's pretty much summarizing what we discussed so far, Dr. Subir. So I think first thing will be trying to identify what we, for anybody, like one person A wants to get a benefit of both sides, I would recommend work with both doctors if you have a ability to do it. So number one, trying to identify the causes. I think which can be done by both allopathy too. When the clients come to us, try to find out who this person is, why are they diabetic, what are the risk factors, and eliminate them. I think that's the biggest thing what I learned from Ayurveda. Try to dig into who they are, why did they get it. So correct their lifestyle and then diagnose them on time. And then I think very early intervening with some Ayurvedic lifestyle and some herbal recommendation through them, if you have somebody along with it, be a best option to go with. But always have an open mind when their levels are much higher, they have much risk factors, or their risk of they try kind of teach them how to find out any emergencies like ketoacidosis or hypoglycemia, how to treat them, because I think those are really critical situations where both our doctors need to be aware and get the patients on the right care. I think those emergency situations, I think the modern care can be better. And also, like a person who are diabetic and maintaining it, co-management with Ayurvedic herbs can prevent their complications. They reduce their chances for getting a kidney affected or eyes affected. I think the co-management really helps them to prevent the complication. I think overall, co-managing it along with the one more person, like an allopathy and Ayurveda doctors together, can get them out of the trouble sooner than later.
Sure. I'm a bit unfortunate over here. I wasn't able to get Dr. Vanita to get her perspective from the Siddha way of looking at things, but I think I will use later forums to get views from her. But I think this has been an incredible discussion, trying to understand diabetes and how we can use all the medical facilities or faculties what we have to manage and treat diabetes. Sometimes it's a research question which I have in my mind that the medicines what we have in allopathy, each medicine would have its own impact in terms of vata, kapha, and pitta. And if we are able to identify those aspects of modern medicine, maybe then we could be integrating them in the Ayurvedic way, the way herbs are used in Ayurveda. It's just a thought, might be a silly thought. I'm sorry about it, but I thought this is a great forum where I can just put up some idea and leave that thought to boil over as we take up another topic for another session. But before I close today's session, I see Dr. Malini's hand raised. So yeah.
Sorry, I just want to make a last point that again, what I've seen in practical is also like, let's say you chose to go Ayurvedic way, but your sugars are not getting controlled. I really encourage them to please, modern medicines are not all that bad. So you need to have like what I see is sometimes we go this way or this way. I think that is what is going to be dangerous for us. I think we need to be open enough to be, if sugars are not controlled, at the end of the day, they're going to cause damage. So I've seen some tendency with some other people that just they're going to go with the same way. They're not going to change the medication. No, they need insulin. They need metformin. They need it to give it under control. Maybe later at the time that we can try to work and take it off. But please do not do that. The sugars have to be controlled at the end of the day. So.
Perfect. And we have Dr. Sangeeta with comments on this, I guess.
Yes, I totally agree with Dr. Malini because I work in integrative center here. I work with a medical doctor. We sit together and we do discuss the things. So that really makes a big impact. Sometimes the rigidity of the client can lead to a big damage. So at what stage, what field can intervene and help? Emergencies always has to be handled in an emergency way, and experiments should not be done in that way. So that really makes a big difference. And in maybe this group, I would be happy to share this thought that as we say that India is turning into a diabetic capital, the reasons could be n number. I would say the awareness should start from the school level. The awareness should start from the minimum basic education level from the children. It should be included in their curriculum, that they should understand that yes, we have to go back to our roots. Bread and jam is not our lifestyle. We have to start to go back to our roots, and small things inculcating in their lifestyle can bring us a healthier youth, is what I feel. And being working for Vaishnavi Trust, working for a very strong reason, malnutrition, I always feel that kids or children are our base, are our future, and they have to be educated for every small thing, how to live, what to eat, what not to eat. So
no, I agree. I think if we start with one simple small step, let's say inculcating the values of Dinacharya and Ritucharya right from that early age, it would change the entire population dramatically. I'm no one to decide for the population. I am no one who has got any understanding on this particular topic, but I just feel that whatever my parents knew, that was actually in the right direction. I was the one who polluted those facts with my so-called understanding of modern science. But anyways, with this, I would like to hand over the stage to Mohan, with thanking everyone over here for sharing their time. At the same time, great thanks to Mohan for organizing this. So Mohan, final remarks from your end, please.
Sorry, Dr. Subir, before we hand it over to Mohan, we have a question live.
I'm sorry, yeah.
So have a patient who is, Vataja Pramehi since 10 years. His HbA1c has come down from 7.8 to 5.3 with meds, lifestyle changes, but diet, but he continues to lose weight. How do I help him? Is a question. I leave it open to the doctors. If anyone wants to volunteer, please do.
Mangal, could you copy paste that comment on the chat so that it's visible to whoever is responding?
I just did.
Yeah.
It's not coming.
No,
Can I?
That's all.
Can I answer?
Yeah, sure. Please,
Yeah, go
please.
ahead.
Yeah, so what Dr. Sumitra is asking here is, although the HbA1c has come down, but and the lifestyle changes and diet have been incorporated, still the patient is losing weight. So basically, what would have happened is they would have started with a Stula Pramehi Chikitsa, and they would have gone into a Krisha Pramehi. The patient would have gone into a Krisha Pramehi. That is Stula Pramehi, meaning a patient who is obese and is a diabetic, while Krisha Pramehi is one who has lost weight and then they are still a diabetic. So if this is the case, then Stulaha Pramehi Balavanihaika Krishastraika Paridurbalascha. That is some Brahmanam, that is giving medicines which will increase the body weight of the person, which will increase the muscular mass of the patient, and regeneration is the way. Most of the time in diabetes, we ask the patient to have less amount of calories, reduce your fat intake, exercise a lot. And in some places, this person might be over exercising. That can also be one of the reasons. We have to look into it. And the calorie intake might be sometimes very, very low. That must also be taken into consideration. That is, this Thula Pramehi has now become a Krisha Pramehi in the attempt to try and cure him or her. We could have overstepped our authority at times. So in this condition, what can be done is usually we start with a Snehapanam and then we go with the Bastis. Initial Snehapanam, after Snehapanam, you cannot go for Vasti. If Ayurvedic doctors will be able to understand this. So we give Snehapanam means giving ghee or oil medicines to directly drink in the morning. This will, of course, the patient must have a very good fat metabolism and their Agni should be very good. But yes, the number of Krisha Pramihis that we get, that is lean people who have diabetes, we get is very less. But then the medicine and the way we treat them definitely stands good. And you'll have to start, Dr. Sumitra, you have to maybe start with some Brahmi Gridam or some Gugulutikta Gridam, which is directly indicated. Gugulutikta Gridam is directly indicated in Prameham. The Falashruti says that. So you should start with a Snehapana. And after the Snehapana, if you feel there is a Pitta Vataja, because the Kapha should have gone down. So in Pitta Vataja condition, you should initially start with a Virechana and then go with a good Dashamula with Yerenda or Dashamula with Bala Kashaya Vasti and the same Gugulutikta Grita Vasti. This usually enhances. I mean, I'm talking very specific medicines here. This might not be exactly, this might not hold good exactly for all the patients, but because a doctor is asking this question, when I'm talking this, she will definitely be able to understand what I'm talking. Thank you.
Dr.
Thank
Sangeeta,
you. We probably it's already too late. We will probably wind up today because we talk Ayurveda. It's 10:45. Being a global call is, we have to take this slot, but we'll try to do something like a 5:30 p.m. or maybe 6:30, 7:30 p.m. Thank you all for the fantastic panelists, and it's a privilege to have in one screen to get to speak to all of them across all disciplines. And the subject is very vast. What I noted down as I was listening is maybe we will pick Dinacharya or even labeled, Gayatri, the way you said, how to even read the label. I don't know. I don't know anything. We just buy what we know, right? So and now, as Subir said, we can't run away from it, especially like if I live so many months outside, right? We have to read what we are buying. So we can take few topics. Probably we will stay within the diabetes because that itself is going to take so many decades, right? But within that, if you can pick, some of you can do videos, some of you can do calls, or we will take a very specific subject and do panel discussion on that. This was an experiment. I am getting excellent feedback parallelly. Thank you all so much. Thank you all people in India staying late to motivate us. And we will continue to do. And on all the panelists' behalf, I'm committing once a month. Hopefully it happens. And thank you all again.
Thank you. Thank you, everyone. Bye.
Thank you. Bye. Good night.